As we age, our hearts go through changes, and for many elderly individuals, these changes can lead to irregular heart rhythms, known as arrhythmias. These conditions are not only common, but they can impact your quality of life, especially in settings like Nigeria, where the healthcare access and awareness vary greatly. This is the topic that we are going to dissect today in this episode of Circle Direct. Please stay tuned. In Nigeria, studies suggest that atrial fibrillation is the most common arrhythmia in older adults, affecting about 4 to 6% of individuals aged 65 and above. Though this true prevalence may be underestimated because there are limited diagnostic resources in Nigeria. So why do arrhythmias become more common with age? Aging causes changes in the heart's electrical system, including fibrosis or scarring of the heart tissue. Now, slower electrical conduction pathways increase the risk of underlying conditions like hypertension, diabetes, and coronary artery disease, which are prevalent in Nigeria. These factors make elderly individuals more prone to irregular heart rhythms. Now, the symptoms of arrhythmias can vary very widely. While some may feel nothing at all, others may experience symptoms like palpitations, fatigue, dizziness, or even fainting spells. Unfortunately, in many cases in Nigeria, these symptoms are attributed to old age and are left untreated, increasing the risk of serious complications like stroke or heart failure. Managing arrhythmias in the elderly comes with its unique challenges. Many elderly individuals have multiple health conditions, meaning their treatment plans must be carefully balanced to avoid interactions between medications. In resource-limited settings, access to diagnostic tools like ECG, which is electrocardiograms, and advanced treatments like pacemakers or catheter ablation can be a serious challenge in our climate. So, medications such as beta blockers or anticoagulants or antiarrhythmic drugs are often used to manage these arrhythmias. However, these medications must be prescribed with care, as elderly patients are more susceptible to side effects. What are these side effects? Bleeding or bradycardia. Family support plays a critical role in ensuring that proper medication adherence and follow-up is carried out. Prevention and early detection are key, so regular health checkups, such as making sure that you have blood pressure monitoring, and lifestyle changes such as reducing salt intake and staying physically active, as well as avoiding tobacco, can help minimize factors for arrhythmias. For elderly individuals in Nigeria, community-based programs can bridge the gap in healthcare access and awareness. Staying active is very crucial, but activities must be tailored to the individual's capacity. Light exercises like walking or yoga or stretches can improve your health and overall well-being. Emotional support from family and friends also helps reduce stress, which is a known trigger for arrhythmias. Meanwhile, in Nigeria, where hospital visits can be challenging for elderly individuals, home-based care and mobile health services are essential. Training caregivers to recognize warning signs and providing telemedical consultations can improve outcomes and reduce the burden on overstretched healthcare facilities. Arrhythmias in the elderly require careful attention, but with proper management, education, and support, individuals can lead fulfilling lives. Let's work together to create a community where our elderly feel valued, supported, and empowered to care for their hearts. That brings us to the end of another episode of Circle Direct. We've spoken at length about the elderly and how arrhythmias affect them, prevention, treatment, and things that they require so that they understand that they're a vital part of our society. We hope you have learned extensively with this episode today. If you have any comments that you want us to get through, please leave them in the comment section below. But do make sure to leave a comment and subscribe to Secondary Podcast on YouTube and all our social media platforms on this channel. Thank you very much, and I'll see you some other time.